So lesson one, which is perhaps a little controversial, a little aggressive, is that modern clinical medicine is as out of control as the banks are, and that it is unaffordable globally, and the time has come to think about doing something very different. And I want to begin with a story. This is the story of Faith and Hope Williams, who were conjoint twins. It got an enormous amount of publicity here in Britain. 20 surgeons operated on them for 11 hours to try and separate them. Hope died during the operation, and Faith died after 23 days in intensive care. The fact that they were conjoint twins had been identified early in pregnancy, but the parents had declined termination of pregnancy. This whole enterprise must have cost some £50,000. And when you think what could have been done with those resources to provide clean water, sanitation, immunisation, oral rehydration therapy for children living in poverty in Africa or South Asia, then that may well have saved 100 lives. I use that as an example, but it's probably not the most futile of medical interventions. There are much more futile ones, and those of you that are doctors will be familiar with them. But it was a very high profile. This slide here shows the expected growth in spending in the US on Medicare and Medicaid, the government-funded systems that make up about half of the health system in the US. And you can see there that the Congressional Budget Office is expecting a growth of this spend being something like 4% of GDP in 2007, up to nearly 18% by 2082. So considerable growth is expected unless we do something different. And I think the important point to make here is that this is by no means just ageing of the population. You can see that ageing of the population accounts for only a small part of the increase. Most of it is just we're able to kind of do more things. Many of them, I fear, not very productive. And there's a website from the Los Angeles Times pointing out that American healthcare has just hit 17.3% of the GDP, by far the highest in the world. But I fear that we are all potentially following that same route. Why does that kind of highly complex surgery and other futile interventions distort healthcare? Well, it means that we have our emphasis on treatment rather than prevention. And I can see why in these circumstances, when you have a sickness service and a health service trying to run side by side, that inevitably everything tends to move towards the sickness service. If a doctor is presented with a child with meningitis or a malnourished child who isn't necessarily going to die right now, of course they're going to put their emphasis on the child with meningitis. And I think what it means is that really we need to separate in some way the systems for treatment and the systems for creating health. And I think it's very uncomfortable for doctors to have to make that decision with patients in front of them. But if you set up the system whereby you shift the resources to prevention, to public health, then I think it is possible to make some kind of progress. Nigel Crisp in his book argues that we have an alignment, he says, of medico-academic, commercial, governmental interests that work very well in the 20th century but now work against patient interests. That all of these, the professions, commerce, technology, everybody's incentivized to do more, treat more patients and increase overall costs. And the public are deceived into believing that greater expenditure is inevitably a good thing and should always bring greater benefit. But as we know, it doesn't. And political parties compete to promise more for health systems. Here in Britain, we're facing a tremendous budget deficit, and yet all the parties are promising to protect the NHS, which will mean incredible cuts in other parts of public expenditure, and I would argue is not the most sensible thing to do. But, says Chris, strong professional groups and systems disempower their patients and restrict their ability to make decisions about their own health. So I'm arguing really that the present domination of hospital clinical medicine was all right, but now is becoming increasingly inappropriate. And I think public health needs to take the lead in arguing that. Maybe it sounds rather aggressive, but I urge you to think about being aggressive.